Now that we have finished taking the history with the patient, we need to move on to the next task. Most likely is physical examination. The case notes will tell you if you have the positive signs or you need to request them from the examiner. For obvious reasons, you cannot have patients in the same room who are not doing examination in the online format. So the task will show you what to do. However, this is like a kind of basic structure or a sentence that you can use to transition from one task to the other. So you can say, okay, thank you, Susan, for all your information. I now need to conduct physical examination. So let me ask the examiner for some findings and I'll get back to you to discuss diagnosis and management. That's just one example that you can make that transition, and you can ask the examiner, dear examiner, I would like to do a complete head-to-toe examination on Susan. However, for time constraints, I cannot do that. I'd like to focus my examination on the respiratory symptoms based on her presenting complaint. And then you will start asking start always the inspection and the general appearance. How is the general appearance of my patient? Is the patient toxic? Is the patient with breathing difficulty? Do you see? And just name the signs what you are looking for. You also ask, can I please have the vitals for my patient? What is the pulse rate and rhythm? Also for respiratory rate, oxygen saturation, temperature, blood pressure. Is there any postural drop? So always start with the general appearance, then the vitals, and then focus on the exam or the area that you need to examine. If you are having a patient that's coming for I don't know, if it's gynecology, you will focus and ask that exam. If you are coming with someone that has a trauma, so focus on the knee or the leg, and always follow the basic examination principles that you are familiar with. Inspection, then palpate, touch, hear, and also do the auscultation if appropriate, and assess movement and function for joints, extremities. So this is pretty much. Once you collect the findings in a order, it's pretty much, if you were having the patient in front of you, you just follow the same order, and then you can make a summary and in your head do all the diagnosis formulation.